Hi, my name is Kathy Gelati, and I'd like to take this opportunity to thank you for visiting this website and for your interest in this research project. As we begin, I thought it would be important for you to understand how I became interested in the study of bad news delivery. So many years ago, I was a unit clerk in a neonatal intensive care unit in Dayton, Ohio, at a children's hospital. I'm originally from Dayton, and I was a unit clerk. So on the very first day of my job as a unit clerk, I witnessed an attending physician tell a father that his child was going to die. And needless to say, that interaction left a lasting impact on me. It became the inspiration for my doctoral studies at the University of Kentucky, which was where my formal training in the study of bad news delivery began. Now, I've spent the better part of the last 20 years studying this issue from the care provider's perspective, and today I come to you and I ask you for your help. You see, some has been written on bad news delivery from the patient's perspective, but there seems to be, fewer studies, number one. And number two, there's not a lot written about how bad news is delivered to patients and then the subsequent impact that it has on patients' decision making regarding their treatment. And that's really where my interest lies, is in sort of what is the impact of the news delivery, not just on your satisfaction with your care provider and your care, but in particular, how did this affect your decisions that you made or are continuing to make about your treatment? Should you decide to participate today, I'd like to tell you a few things that you'll need to know about the study. So number one is that you must be at least 18 years old to participate. Number two, I would ask you that when you tell your story on the forum, that you do so with as much detail as possible, but please omit any names of care providers. We don't want care provider names out there. We don't want anything to be identifiable to any particular individual. And instead, if you would just talk about people in terms of their role, my physician, my doctor, my respiratory therapist, etc. Three, please know that if you post on the website, you are essentially giving me permission to use your story in the analysis of the research and to publish about it, and also in conference presentations to also speak about the stories orally. Now, but I also want you to be rest assured that nothing will be said in any presentation of the findings that could be linked back to your identity. So your username, nothing will be included that can identify you as a particular individual. The next thing you need to know is that, if you decide to participate and you post your story, and if for some reason at any point you decide, I don't really feel comfortable doing this, I want to withdraw, you can contact me, and all my contact information is on the website. You can contact me and let me know that you would like to withdraw, and I will omit your story from the findings. The next thing that you need to know is that you don't have to have been the patient yourself. So, for example, maybe you're a parent and it was your child who was the patient, but you still received the bad news on behalf of your child. And we would hope that you would continue to feel comfortable posting about your child's experience since you were the recipient of the news. Those stories are of much value as well. Next, I would tell you that this is a public forum and it's set up as a discussion board. So people will be able to respond to each other's posts on the website. And I'm hoping that's really a good thing, that it creates a sense of community for all of us. Everyone that's been a patient, and that you'll be able to relate to one another. Finally, I'd like to say that you can contact me at any time through the website. My Purdue email address is there. There's an email function in the website itself, and my phone number is listed as well. And finally, I'd like to say that I am not limiting this study to any particular diagnosis. So if you think it's bad news, it's bad news. Bad news is defined by the recipient. It's in the eye and the ear of the beholder. What else can I tell you? Oh, the research findings will be visible on the website. So after I've compiled all the research and done the analysis, I will post the findings on the website, and the website will be live for at least 1 year. So as I wrap up, I'd like to say thank you again for considering participating in this study and for giving voice to your stories. I look forward to seeing you on the forum.